Today I'm going to be demonstrating how to give an IM injection. The first thing I would do would be to obtain the physician's orders. Then I would go ahead and check to see if the patient has any allergies and gather all of my supplies. Then I'll go ahead and wash my hands. Then I'll follow the 6 patient rights, the right dose, the right medication, the right time, the right route, the right patient, and the right documentation. Then I'll go ahead and make sure that I have the correct syringes and needle gauges. In this case, I have a 3 milliliter syringe, and I have a 20 gauge needle, 1.5 inch length. You can also have a 21 or 22 gauge, and a 1.5 and 2 inch needle length. Then I will go ahead and check the medication 3 times. Once at the Pyxis, once when I'm drying it up, and once at the patient's bedside. And I'm going to be checking for expiration date, the actual medication, to make sure it is the right medication and the dosage. Then I will go ahead and draw up the medication. So the first thing I would do would be to clean the top of the vial with the alcohol wipe. Then I'll go ahead and pull up 0.4 milliliters of air. So I will be giving 0.4 milliliters of sterile water. Then I will inject it into the vial. And then draw up 0.4 milliliters of sterile water. And there is a little bit of air, so I gotta get the air bubbles out. And get up to about 0.4. So as you can see, it's at 0.4 milliliters. Then I'll use the scoop up method to recap the needle. Then I'll go ahead and change out my needle to the 20 gauge, 1.5 inch for the injection. Then I'll go ahead and label it and bring it to the patient's bedside safely. So then I'll walk into the patient's room. I will introduce myself. As I'm introducing myself, I will be washing my hands, and then I'll apply my gloves. I'll identify the patient with 2 identifiers, their name, their date of birth, and ask again if the patient has any allergies. And I'll go ahead and take their vital signs, check any lab work that I need to check prior to giving any medication. And if the patient cannot tell me that they have any allergies, I'll ask a family member that could be in the room. Before I give the injection, I'll determine what sites I could give the IM injections. One would be the deltoid, so use your 3 fingers, start at the acromion process, and right under your 3rd finger is where you would give the injection. Then for the dorsal gluteal, you'll make the square chart on the buttocks, and the outer top squares where you would give the dorsal gluteal injection. Then for the vastus lateralis, you make a shape like this with your hands and put it on the outer thigh and give the injection right between the hands. And for the ventral gluteal, you'll find the hip bone right here, and it's kind of hard to do right now, but with my middle finger I would find it and make a V and give the injection right in between the V and the little muscle pocket. So as I have identified the site, I will go ahead and cleanse the site with the alcohol wipe, and as that dries, I will get my needle ready, and I will not air dry it or fan it. So then I will pull the skin taut with a 90-degree angle and dart-like motion. I will insert the needle, inject and let go, and then inject the medication slowly, and then release. Check for any blood, and put a cotton swab if there is any blood, and with light pressure, and then I will dispose of the needle in the sharps container and any other needles that I have.